Well, it's a pleasure to be associated with Heart Failure Essentials. I have been giving blessings, and I am very glad that Dr. Dhal has done a marvelous job by imparting education on a subject which is quite neglected in our country, not only in our country but throughout the world. It has lots of problems. Throughout the world, it is a challenge really. I think I call it a last frontier. We have still to conquer this disease all over the world. In India, it's such much a bigger problem, and I'll be talking actually without much evidence that we have in our country. It will be just personal musings, which I will suggest what we can do and so on and so forth. Well, I have been told to ask to speak about heart failure in India. What are the challenges? What is the scope of the problem? You all know that heart failure is a global burden. It involves almost all the countries, and you can see the incidence, which is quite different in different parts of the world, but the data is not available throughout the world. Especially India is completely missing. It can occur even in small countries as much as 6.7% as compared to United States. So I'm sure India will be quite close to that. So first thing which is missing in India is we do not know the magnitude of the problem. And we all know that there are a large number of people suffering from this disease, and this is a increasing epidemic with a very bad prognosis. As the ages increase, the disease also increases markedly. And I think I like this slide. It's an old slide, but heart failure causes more deaths from heart than cancer combined. I think this we should use because there's a lot of research, a lot of money being given to cancer. But this is the worst form of cancer that you know of, which really has worse prognosis, but nobody has given any attention. So I would suggest to my colleagues who are short of funds that use this, that this is the worst form of cancer because the prognosis is much worse. And this is 5-year survival rates among female with heart patients are much higher than in breast cancer. It's about 50% as compared to 77% survival. And even in men, the survival rates are much less as compared to prostate cancer and all. So I think this is a worst form of cancer that you can have. And one of the things we can use in future is to tell the authorities as well as the people that this is a worst form of cancer. And this cancer everybody is scared of, everybody gets so much funds and all. We don't get anything for this heart failure. So I think I like this slide. Now what is the heart failure in India? Is it iceberg tsunami? Well, we do not have the data exactly, but India is home to 16% of global population. 25% of the world's coronary heart disease occurs in India, and there are 120 million hypertensives here. This is a very old estimate, and with the newer definition, I'm sure it must be more. And large number of individuals are there who have rheumatic heart disease and other tropical diseases like cardiomyopathy, etc. And cardiovascular disease will be the leading cause of mortality and morbidity in India by 2020. This is the data which has been extrapolated and told by so many people. Well, there is a high burden of heart failure in India because there is a rise in risk factors of traditional cardiovascular disease. There is also persistent of pre-transitional diseases like rheumatic heart disease, infective diseases. Therefore, India is facing the double burden of heart failure because rheumatic heart disease still is one of the very important causes. If you go to the outpatient department of some of the hospitals who treat poor patients, rheumatic heart disease, like All India Institute of Medical Sciences where I was working, rheumatic heart disease still remains on the top. And the heart failure appears to be very high. Estimates, anybody can guess, according to 4.5 to 10 million people are suffering, and annual incidence may be again about 500,000 to about 2 million. So this is just extrapolated. These are not really the number. And rheumatic heart disease is a big problem here. 20% of people who have rheumatic heart disease get heart failure. Coronary heart disease, again 5% roughly get it. And hypertension 5 to 10%. Diabetes, we have very large number of more than 200,000 people suffering. So if we have such high incidence of these diseases, heart failure is going to be really very high. It's really going to be a big tsunami. There are differences, again very small number of studies which are available which show that heart failure is a bigger challenge for India because the mean age of patients is much less as compared to the Western countries, 53 years, as compared to 73 years. In hospital mortality is very high, about 10 times higher than what is reported in the West. Post-discharge mortality is also very, very high. So these are the peculiarities of our heart failure, that it occurs at a younger age and very high morbidity and mortality, and this needs really introspection. And as you all know that it's a chronic disease, and every admission means worsening of the heart condition. And of course it increases mortality. Everybody knows these are old slides in hospital as well as after discharge, and rehospitalization is very, very common. So impact of hospitalization is that 1 in 5 patients die, 20%, and 1 in 4 patients will die, will get repeated hospital, 25% will get that. So this is the other problem. There have been a lot of progress in heart failure. I have been practicing for the last 55 years cardiology, and we used to have only digoxin diuretics, and there was nothing else which was available for heart failure. But now we have so many drugs available. I will not go into details. We have especially ARNI and all. There are surgical techniques, and there are other techniques which are available, which have really improved the prognosis markedly. But unfortunately, we do not follow the guidelines, and these are the guidelines which have been emphasized by Dr. Dhal also, that we try to tell the doctors that they should follow the guidelines, but for some reason or the other they are not followed, not more than 25%. Even if the medical treatment is, for example, tried and given optimally, you can see the 3 drugs, ARNI, beta blockers, and the mortality could be reduced by 63%. And of course, ARNI is costly. We have to find out the cost effectiveness here. It's a very good drug, but for India, it's a very, very costly drug. But even ACE inhibitors, beta blockers, and MRA, if they are used, 56% reduction in mortality can occur. But as I will tell you, this follow-up is very, very poor. The patients are given less than 50, and all the 3 drugs are given to less than 25%, according to some registry like Trivandrum registry and so on. Each one of them is beneficial, but unfortunately, they are not used that much. Diabetes is a big problem in our country. It increases the rate of hospitalization and death. We all know that, and we are the diabetic capital of the world, and therefore we have to be very careful about diabetes. And it's very good that new drugs have come in which can improve heart failure, SGLT2 inhibitors and so on, which will be talked about it. Now, what are the gaps in knowledge? Well, everything is a gap, I would say. There's hardly anything known. There's a complete lack of epidemiological data. And I would suggest it can be obtained if there are people who are interested. We have such a big country, we can divide into 4 parts, south, north, east and west, and some of the people can really get some data, and a lot of surveillance data is possible. There's a lack of knowledge among the clinicians, and I hope this conclave, Dr. Dhal's work has improved that. I have been a clinician for a long time, and heart failure is one of the most ill-diagnosed disease. It's overdiagnosed or underdiagnosed. I have seen people coming to me for a long period of time, where they're going to hospital with huge ascites and all, treated with cirrhosis. Anybody who has dyspnea is considered as heart failure, because we did not have those markers and all. I think markers should be encouraged so that these misdiagnosis is not there. Lack of guidance-based therapy, as I told you, it's very low. It's less than 25%. Lack of emphasis on lifestyle. We have to think of cheap methods, and lifestyle is my favorite thing. Diet, exercise, stress, obesity, smoking, and these days iron deficiency. And I will talk something about stress, because I think that's an important factor. Cost-effective strategies for Indians have to be worked out. We have not done it. Lack of heart failure clinics, lack of device-based therapies, and role of yoga, which is my interest. Exercise is not used. You can see that meta-analysis shows that this reduces mortality as well as improves the quality of life. Should be encouraged. Again, clinicians are really scared of patients who are class 3 or so, and there is a definite role of heart failure clinics. Unfortunately, some places in India are having it, and there is, of course, we need to have a heart failure nurse. Not only nurse, we need psychologists and nutritionists, but a yoga therapist also, because I think stress is a very important factor which has been neglected, and if you see the biochemical changes in stress, they can produce heart failure also. And depression is very prevalent in heart failure. As much as 30% could get it, and associated with almost 100% more mortality. And relationship between depression and poorer heart failure outcome is consistent and strong among multiple endpoints. And controlling depression appears logical. This is the old study. You can see that people who have severe depression, they have about 50% mortality as compared to less depression, which is about 20%. So it's almost doubles, which completely neglected, and therefore other anxiety, etc. Some method should be used which can be control this, although we have very little data on this, but there is strong evidence that yoga, which is not only a few postures, but a complete way of life. It includes not only the diet control, it also includes the stress control, exercise, and avoidance of tobacco. All this is one of the holistic methods. We have been using it, and this is coming to prominence. Those of you who are attending the AHA, one of our paper is accepted as a late-breaking trial, that is cardiac rehabilitation. This is the largest study ever done in American heart. If it's taken as a late-breaking trial, I'm sure that this will come in the so-called the conventional medicine. And a lot of studies are done to find how yoga helps. It changes the neuroendocrine profile completely on one side, and the other side stimulates the vagus autonomic balance is there, and this is how it can improve heart failure. There are a lot of studies to show that. Yoga is also useful in almost all steps of cardiovascular continuing, starting with the risk factors, oxidative stress, even regression of atherosclerosis, arrhythmias, and heart failure. Just briefly, very few studies are there. This is one study which is reported from India, 130 randomized study. It showed that there was an improvement in ejection fraction and a marked decrease in the biomarkers like NT-proBNP, and there was an inverse relationship between the two. So there are some studies, and there is a couple of more small studies that it can improve the quality of life and peak VO2. So heart failure is a growing public health epidemic for India. It's maybe the biggest tsunami that we have once we know the data. It should be quite high. Occurs at a young age, with higher mortality, inadequate guide-based therapies, poor compliance, lifestyle modifications is not emphasized, very cheap, that's why I'm discussing about that, and preventive strategy is ideal, more research needed for cost-effective strategy, role of yoga needs to be, and this is my final message to you. Old Chinese proverb, I'm sure this really holds true in heart failure. Superior doctors prevent the disease, so heart failure should be prevented, primordial prevention. A lifestyle modification so that none of these diseases like rheumatic heart disease or coronary or hypertension, this can be achieved, and yoga can improve the compliance of this. Yoga could be used as one of these techniques, although we don't have much data. Mediocre doctors treat the disease before evident. At least we could be that. If a patient has hypertension, coronary artery disease, very early stage detection, and then try to treat it aggressively. And of course, inferior doctors also do a great thing that they. So I think if we have to tackle the problem, cost-effective method will be prevention, starting with primordial, primary, and secondary. Thank you very much for your.